In the United States, Down syndrome is still the most frequent chromosomal disorder. Each year, approximately 6,000 babies in the United States are born with Down syndrome. This means that Down syndrome occurs in about 1 in every 700 babies. Down syndrome is a chromosomal disorder in which a child is born with an extra chromosome. Chromosomes are the body's little packages of genes. They shape and function a baby's body as it develops during pregnancy and after birth. A baby is born with 46 chromosomes on average. One of these chromosomes, chromosome 21, has an extra copy in Down syndrome babies. Trisomy is a medical word for having an extra copy of a chromosome. Trisomy 21 is another name for Down syndrome. This extra copy alters the way the baby's body and brain develop, posing mental and physical obstacles for the child. Despite the fact that people with Down syndrome may act and seem alike, each individual has unique abilities. People with Down syndrome typically have a mild to moderately low IQ, intelligence quotient, and speak more slowly than normal youngsters. Clinical presentation and history. The following are some of the most prevalent physical characteristics of Down syndrome. Flattening of the face, particularly the bridge of the nose. Eyes that are almond-shaped and tilt up. A slender neck. Ears that are little. A tongue that is protruding from the mouth. On the iris of the eye, there are tiny white specks. Hands and feet are little. A single line across the hand's palmar crease. Pinky fingers that bend toward the thumb on occasion. Muscle atrophy or sagging joints in his children and adults. They are shorter in stature. Types of Down syndrome. Down syndrome is divided into 3 categories because the physical characteristics and behaviors of each kind are so similar. Most people can't detect the difference without looking at the chromosomes. Trisomy 21. Trisomy 21 is present in around 95% of people with Down syndrome. 2 instead of the usual 2 copies of chromosome 21. Each cell in the body's 3 copies with this kind of Down syndrome. Translocation Down syndrome. Translocation, a small fraction of people with Down syndrome have this kind of Down syndrome, about 3%, when an extra part or a whole extra chromosome 21 is present, but it is attached or translocated to another chromosome rather than being a separate chromosome 21. This occurs. Mosaic Down syndrome. Mosaic Down syndrome is a kind of Down syndrome that affects roughly 2% of people with the condition. Mosaic is a term that refers to a mixture or combination of things. Some of the cells in children with Mosaic Down syndrome have 3 copies of chromosome 21, while others have the standard 2 copies. Individuals with Mosaic Down syndrome may have the same characteristics as other Down syndrome children. Due to the presence of some or many cells with a typical number of chromosomes, they may exhibit fewer symptoms of the illness. Diagnosis. Screening tests and diagnostic testing are the 2 types of tests available to detect Down syndrome during pregnancy. A screening test can notify a woman and her doctor if her pregnancy has a reduced or higher risk of having Down syndrome. Although screening tests cannot provide a definitive diagnosis, they are safer for both the mother and the developing fetus. Diagnostic tests can usually predict if a newborn will have Down syndrome, but they are more dangerous for the mother and the growing infant. No one, not even screening or diagnostic testing, can foresee the full impact of Down syndrome on a baby. A blood test, which analyzes the level of several compounds in the mother's blood, e.g., MSF, triple screen, quad screen, and an ultrasound, which provides an image of the baby, are frequently used in screening tests. The fluid behind the baby's neck is one of the items the technician looks at during an ultrasound. Extra fluid in this area could be a sign of a hereditary issue. These tests can help establish whether or not the infant is at risk for Down syndrome. Screening tests can occasionally produce an abnormal result even though the kid is perfectly healthy. Even if the test findings are normal, they may miss an issue that exists. Diagnostic test. Diagnostic tests are mainly used to confirm a Down syndrome diagnosis after a positive screening test. The following are examples of diagnostic tests. CVS, chorionic villus sampling checks placental tissue. Amniocentesis is a procedure that checks the amniotic fluid, the fluid from the sac surrounding the baby. Blood from the umbilical cord is examined via percutaneous umbilical blood sampling. PUBs. These tests check for chromosomal abnormalities that could imply a diagnosis of Down syndrome. Risk factors. The additional chromosome 21 causes physical characteristics and developmental problems in people with Down syndrome. Researchers know that an extra chromosome causes Down syndrome, but no one knows why it happens or how many distinct variables are involved. The mother's age is one factor that raises the chances of having a kid with Down syndrome. Women who become pregnant at the age of 35 or later are more likely to have a Down syndrome-affected pregnancy than women who fall pregnant at a younger age. 3-5, however, because there are many more births among younger women, the majority of Down syndrome kids are born to moms under the age of 35. Treatment options. Down syndrome is a chronic illness that lasts a lifetime. Early intervention can often aid newborns and children with Down syndrome in improving their physical and cognitive abilities. The majority of these services are geared toward assisting children with Down syndrome in reaching their full potential. Speech, occupational, and physical therapy are examples of these treatments, which are normally provided through early intervention programs in each state. Although many children with Down syndrome are integrated into regular courses, they may require additional aid or attention at school. Learn more about various kinds of syndrome at EcgKid portal and subscribe to get latest updates. Thank you.